Hi, I'm Measha Brueggergosman. This is Dr. Teresa Kieser, and I'm a soprano who happens to be in Calgary. I'm an opera singer, and I was singing with the Calgary Philharmonic. So I woke up with severe chest pain. I went straight to the hospital, and it was revealed that I needed a double bypass. And the woman tasked with giving me my surgery was Dr. Teresa Kieser. Now, people were undoubtedly sure that you would be my surgeon. Can you tell me why?
Well, they requested me because I like to use more than just one artery for bypasses. Arteries last longer because they're used to the blood pressure of an artery, which is 120/80.
Okay.
Whereas a vein has a pressure of about 35/25, so it may not stand up to being an artery as long.
Well, my first question was, well, why do they use veins anyway?
Well, it's the way cardiac surgery started. It worked very well, and it was easy technically to use vein than an artery. And everybody gets one artery for sure, but I happen to believe the more the better. Well, in 10 years, more than 50% of the vein grafts from the legs are blocked, totally blocked. In 20 years, more than 90% of artery grafts are open. They last longer.
Yeah,
and
they last longer.
You want to, I don't believe for 1 minute that every bypass I do stays open, but all the ones that do are arteries.
I see. Who is this?
What's
going on here?
The
Who's
Libin
that?
Cardiovascular Institute of Alberta is where I work. It's affiliated with the University of Calgary. So they have been very supportive. They've let me do anything.
What people can do to advance the conversation for arterial bypass over vein?
I think get on the web, look it up for yourself. So this is what I would recommend. Do your own homework. Find out.
Amazing.
And ask your surgeon if they use artery. And they'll say, yes, they use one, but ask them if they use more than one. Ask them how many they've done more than one.
Oh my goodness.
You want an experienced surgeon.
And I also think it's such a beautiful thing to elevate the industry, because it is a better way forward. Everybody benefits. People become more skilled. We'll probably know more, because we haven't even touched the surface of all the research that you have personally done.
Well, then we can teach the young to do it.
Yes.
And that's it. So this is what my method has been. Is to get to the young, get young surgeons and train them, and they immediately embrace it.
I am so grateful. I'm feeling better and better. I still have like a bit of shortness
only
of
11
breath.
days post
11 days off pump.
Yes, off pump.
We might want to just throw that in.
Yeah.
Doing a surgery off pump was also my experience. Now, what is the difference between on pump and off pump?
Well, we didn't stop your heart.
Okay.
We just kept it beating and stabilized that little postage stamp that we need to make the connection on the two areas, and it works very well. Yeah.
Another optimization of the surgery, if you want to talk about it, are the blood things that made me give me more blood, like the shots I got?
I use something called EPREX, which is just a subcutaneous injection to stimulate her own bone marrow to build up her blood. It takes 3 weeks to work, but you'll need blood then too.
Why will I need blood in 3 weeks?
You've lost some blood, you replaced it, but if you had gone on pump, you would definitely need it in 3 weeks.
Okay.
But you didn't go on.
I did not go on
so
pump.
It's not quite so critical, but you came in with a low hemoglobin. So I didn't want you to get any transfusions, and you didn't.
The last point about vitamin Dizzle, because you told me that vitamin D, the secret love of vitamin D.
We have an intensive care specialist, Dr. Frank Wachowski, who just swears by this, and I have been looking to see on all my patients who is vitamin D deficient, and it's like 90% of people. I would go on vitamin D in this area of the world, which is Alberta, Northern Hemisphere. You need 4,000 units a day. This helps your immune system, for protecting against infection, against cancer, everything, but you have to take it for the whole of your life. And it just really helps.
I will. I just am so grateful that you've come into my life, and I just know that I'm going to feel so much better. Even starting at this point, I can already tell, despite how much more healing I have to do, that I'm already that much more ahead of the game.
You deserve it.
Thank you.